Welcome back. How do nurses spend their time? Nurses spend their time doing documentation, medication administration, care coordination, patient care activities, and then patient assessment and vitals. You will agree with me that majority of nurses' work is documentation. They spend more time doing documentation among others, according to Hendrik et al. Now, we want to look at the EHR, the electronic health record system, and how it works. Every system or software, I'm looking at the software side. The EHR is not only software, because there are other hardware integrations, especially when telehealth is involved. But when we are looking at it from the software perspective, there are two types of, or three, but let me focus on two. We have the open source and then the commercial softwares, okay? So for the free and open source, any private hospital, any small institution can take it and use it. And we have a lot of open source EHRs that are free. You don't pay for any of them. There are also what we call the standalone ones. That one, if you are in a place where you don't use much internet, you can use some of these technologies that work effectively for small places. Now, we are also looking at, there are web-based ones, there are commercial ones that you can clone to suit your organizational needs. I have some pictures here of the EHR. You can join the classroom and get access to some of these resources so that you will see how it works. And when you get to the hospital, you see how to manage yourself. This page, I have a sample prescription entry screen for order management. I have the vital signs documentation screen. I have the sample patient record so that you know your patient and the particular patient. It removes and eliminates the paper-based aspects of the nursing work, which saves a lot of time and a lot of space. So that is how the EHR works. Now let's look at the proficient use, how to effectively use it. The EHR gives us some of these benefits. Number one, improved legibility, meaning that when people write, you can see. Reduce medical errors, because if I write, you can't see, there's likely to be errors, and humans make mistakes. EHR systems eliminate duplicate screening and testing, especially in situations where we don't know what to do about a particular patient, or something has been done about the patient and it has to be done again. The EHR simplifies everything about the patient. There is shared data, everybody is able to, it eliminates the paper-based islands, basically. It's easy to access and information is available. It provides complete information, improve efficiency, reduction in cost in the long run. Okay, now there are 8 core functions of an EHR. We have the health information and data recording, order management, result management, patient support, administrative processes and reporting, decision support, electronic communication and connectivity, reporting, and population health. You can access the resources when you are free. I also have workflow in a typical office where the EHR system is used, how people move from client phone office up to test results, and then other diagnoses are made. So this is where we'll end this aspect of the video. But when we come to Ghana, the electronic based quality in Ghana, the healthcare, I've always recommended that you can visit their website, the Ministry of Health website. You have access to all the things they intend to do and all the things and all the statistics that you need about our advancement in the health sector. A report was made that revealed that such methods of documentation reduces the time spent at the bedside for patients. A study was conducted, and based on that study, they realized that in Ghana, when we use the EHR, it will really reduce or help us to spend more time at the bedside of patients rather than wasting time on documentation. We need our nurses to be by our patients, and be monitoring and be able to do other stuff, not spending time on so much administrative work. Thank you. See you in the next video.